And here we go. So thanks for joining us for the presentation on HUD's ESG-CV regulations and vouchering. A couple of housekeeping items as we get started. Please note that we're recording, so we'll get this posted as soon as possible later this week for your reference if you need it, and for anybody else who can't join us today. And if you would just hold your questions to the end. So with that, let's get started. As many of you know, HUD released the ESG-CV regulations on September 1st of this year. CARES has reviewed the regulations in depth and attended informational webinars, and from there we've teased out information relevant to you who are operating CV-funded, ESG-CV-funded projects. The purpose and goal of the presentation is to review opportunities and waivers in ESG-CV regs that impact your projects and perhaps impact planning for ESG-CV2 funding. We also want to provide a high-level overview of the vouchering process. Please note that CARES will send out a PDF of this PowerPoint, a summary of the regulations, and a list of FAQs this week. And we'll keep updating FAQs as we go along. During the presentation, we'll start by defining ESG eligible activities, just to provide an overview and to remind you all, who I'm sure you're all very familiar with at this point. We'll then provide an overview of the ESG-CV regulations, including requirements related to additional eligible activities, waivers and flexibilities, and spending down of funds. We'll then review your projects and answer any questions you have based on the new regs. Finally, we'll provide a high-level overview of the vouchering process, including CARES' role in that process. As a refresher, on this slide, you see the ESG eligible activities. The first is street outreach, which includes reaching out to unsheltered homeless individuals and families, connecting them with emergency shelter, housing, or critical services, and providing them with urgent non-facility-based care. The second is emergency shelter, which includes renovation, essential services, and operations. The third eligible activity is rapid rehousing. Eligible costs include rental assistance and housing, relocation, and stabilization services. Next is homeless prevention. Eligible costs include rental arrears and assistance, and housing, relocation, and stabilization services. Just a reminder here that prevention costs can be used for ongoing rental assistance for at-risk households. And finally, HMIS and administrative activities. Moving on to ESG-CV, the CARES Act designates $4 billion for the Emergency Solution Grant Program. Funding was designated to prevent, prepare for, respond to, and mitigate the impact created by COVID for households entering and currently utilizing the homeless service system. Next, we'll review the ESG-CV regs. As previously mentioned, the regulations were released on September 1st of this year. Please note that this document is in itself a waiver document. Overall regs are still based on the original or annual ESG regulations. The notice is divided into 7 sections, which we'll verbally summarize today. And again, CARES will send out a document summarizing these regs after this presentation. In terms of program components, all regular ESG requirements apply except the emergency shelter and outreach caps are waived. We anticipated this would be the case, but now it is codified. This is important to know when planning for ESG-CV2 funds. And pre-award costs are eligible. This is important if you're an agency interested in utilizing funds for costs you've already incurred, for example, hazard pay. Specifically, the regs state that you are allowed to cover or reimburse costs after the date the community first began preventing, preparing for, and responding to COVID, provided they were spent to address COVID, which in Albany, not Albany, we're in Columbia now, sorry, was around mid-March. An important tenet of the ESG-CV regs is that funds must be used to prevent, prepare for, and respond to coronavirus among individuals and families who are homeless or at risk of homelessness. In addition to the activities allowable under ESG guidelines, the following activities are newly allowable under ESG-CV regs. We'll take a minute to describe each one, as you may be interested in utilizing funding within your projects for these activities. You may also want to think about it if you would be interested in incorporating any of these activities into your ESG-CV2 plan. We'll now discuss waivers, requirements, and flexibilities as stated in the notice. This is important for your agency to know the parameters affecting your project's implementation, including participant eligibility. These parameters may also affect what you're interested in focusing on for ESG-CV2 funding. First, in terms of emergency shelters, funding may be spent from the date the community began preventing, preparing for, and responding to coronavirus through January 31st, 2022. All other activities are eligible through September. In terms of rental assistance, under these regulations, short and medium-term rental assistance is allowed and is defined as between 3 and 12 months worth of assistance. This differs from the annual ESG regulations, which allow rental assistance for up to 24 months. In addition, the fair market rent requirement for units is waived. Units may be approved if they meet rent reasonableness. If you have any questions about how to determine rent reasonableness, please just reach out to us. We're here and happy to help anytime. Next, hotel motel costs are eligible solely under the emergency shelter activity. Hotels, motels can be utilized for ongoing shelter and/or quarantine or isolation of those in other housing programs. Additionally, funds can be used to pay for cleaning and repairing damages caused by program participants above normal wear and tear of the room. There's also a waiver of the 24-month assistance over 3 years cap. Participants who reach the 24-month cap between January 21st of this year and March 1st of next year, 2021, are able to receive continued assistance for up to 6 months in order to maintain housing or prevent homelessness. Finally, legal services are limited to those necessary to help program participants obtain housing, not from losing housing. Again, as an overall reminder, costs may only be spent as necessary to prevent, prepare for, and respond to coronavirus. The regulations also outline ESG-CV program requirements. Again, this is important for your agency to understand HUD's expectations in implementing your projects. In terms of housing stability case management, HUD is waiving the requirement that housing case managers meet no less than once per month. This waiver is allowable through the period the recipient or subrecipient uses funds to prevent, prepare for, and respond to coronavirus. HUD also requires recipients to establish procedures to prevent duplication of benefits through any and all federal funding streams. And finally, although HUD strongly encourages the use of supportive services when necessary, individuals and families experiencing homelessness must not be required to receive treatment or perform any other prerequisite activities as a condition for receiving services. We also want to make you aware of some of the policy priorities HUD emphasizes in the regulations. First, subrecipients may include agencies not currently or previously funded by annual ESG awards. Also, HUD encourages a focus on supporting participants in obtaining independent living, sobriety, employment, self-sufficiency, and housing stability. However, again, please note that projects remain prohibited from requiring treatment or other activities as a condition of receiving assistance. Projects must also prioritize households based on need, which again will be achieved by working through the coordinated entry system. And finally, funds must be used to prevent the spread of coronavirus and to quickly connect persons to housing. Another element of the ESG-CV regs we want to highlight for you is regarding the spending down of funds, or what HUD calls expenditures. HUD is requiring that at least 20% of funds, including first and second round of allocations, must be spent by September 30th, 2021. At least 80% of the funds, including first and second round allocations, must be spent by March 31st of 2022. And shelter funds must be spent by January 31st of 2022. This is important for your agency to know in order to plan accordingly for spending down. CARES will be supporting these efforts by creating a tracking process to ensure the community spends down by the deadlines. Ultimately, spending down for these deadlines is incredibly important for the community, as HUD does have the ability to recapture funds if these deadlines are not met. We also want to note that if you're having trouble spending down or see needs in the community that are changing from what we anticipated, please remember that you may request to shift funds to another eligible activity if approved by the recipient. There are two types of reports that are required for using ESG-CV funds. The first is a paper report, which is due 180 days from the program's year end, and quarterly reports are due 10 days after the end of each calendar quarter for city ESG-CV funds, and 5 days after the end of each calendar quarter for state ESG funds. While CARES will be running these reports, we will likely have to reach out to agencies for additional information, such as a list of activities carried out with ESG-CV funds. Please be aware this information is required for HUD reporting, so please plan accordingly. Also, please note, not applicable in this case, DB agencies will need to submit their own paper and quarterly reports. So we'll answer some frequently asked questions about the ESG-CV regulations. Please note that, again, we'll post a document of these FAQs on our website, and we'll continually update. How do I document that funds are being used to prevent, prepare for, and respond to coronavirus? It is actually not required that you document funds that are being used to prevent, prepare for, and respond to coronavirus on a client-by-client basis. Rather, the recipient, in this case the county, will document this by providing documentation of when the community began preventing, preparing for, and responding to COVID per activity in IDIS. Another question, do the existing CARES Act waivers apply to the ESG-CV funds? And the answer is yes. However, waivers are set to expire at the end of September. HUD is working on extending the waivers. Meantime, if your agency needs a waiver, please contact us at CARES. We will handle submitting requests, I believe. We might have to clarify that. I'll ask Kelsey to Kirsten to clarify that at the end of this. Question number 3, am I allowed to utilize waivers, flexibilities listed in the ESG-CV regs for my normal ESG projects? It is allowable to apply ESG-CV regs to regular or annual ESG projects if funds are being used to prevent, prepare for, or respond to coronavirus. There are numerous conditions, so please reach out to CARES if you're interested in utilizing annual ESG funds in this capacity. Another question, am I allowed to utilize prevention funding during the eviction moratorium? The answer to this is it depends. So if someone is at risk of eviction but covered by the moratorium, then they are not at risk of homelessness and not eligible for ESG-CV prevention assistance. If someone is at risk of eviction even though covered by moratorium, in other words, if a landlord is trying to evict someone during a moratorium, they are eligible to receive legal assistance. Document the circumstances that make the client eligible and at risk of becoming homeless. If someone is not covered by the moratorium and still at risk of homelessness, in other words, if someone is being evicted for reasons other than non-payment of rent, being doubled up, moving more than twice in the last 60 days, or any of the other scenarios applying to the at-risk of homelessness definition, they are indeed eligible for eviction prevention assistance. So we'll go on to questions and discussion. After we hit what our next steps are, CARES will be working internally with the grants and contracts folks. They're on the call now, and HMIS teams to set up your projects in HMIS, and we'll notify you when they're all set up. In terms of planning for ESG-CV2 projects, we're recommending that you start that in late October to see if anticipated needs change in any way. And lastly, CARES will be drafting updates to the written standards per ESG-CV regulations, and will present it to the community for edits and approval as we do each year. And that's about it from me. Do you have any questions regarding regs as they apply to your individual projects or for planning for CV2 funding? No? I'll take, oh, go ahead.
I have a question.
Mm-hmm.
So you said that if there's a moratorium, then we could use the funding for legal services, but not for client financial assistance. Is that what you said?
I can answer that one, Maggie, if you want.
Okay. Sure.
So it depends, Bob. If somebody is evicted for reasons other than non-payment of rent, you can provide assistance. You can also provide a rental assistance for somebody who meets the other criteria for at risk of homelessness. So for example, if they're doubled up, if they're exiting a publicly funded institution like a prison or a hospital, if they've moved more than twice in the last 60 days due to economic hardship, those are all reasons that you could provide rental assistance. But it's going to be tricky providing rental arrears during the eviction moratorium.
Okay. Thank you.
Anybody else have any questions?
Yeah, hi, it's Charlotte. I was just wondering, able to provide some oversight to this being just our CARES Act grant. So is it possible, will you guys like send me something that just shows like the budget of each case and how much they spent, or can you just make a copy of maybe your grants gateway? As you send those in, can I get a copy of those just so I can keep them for my board of supervisors?
Absolutely, we can get copies of whatever you need, yes.
Thanks.
Mm-hmm. If there are no other questions, I'm going to turn this over to our grants and contracts folks to talk about vouchering.
Okay. So thanks, Maggie. So as Maggie mentioned in the beginning, this is sort of just a high level overview of vouchering and just a little bit of the sort of funding flow to hopefully clear up for everybody when and how you would be receiving reimbursement for your projects. So you can go, thank you. So for Columbia County, CARES is considered the lead contractor for the county. And so what that means for us, what our role is as the lead contractor is a couple of things. So preparing subrecipient contracts for signature. So Kirsten actually just got more information from OTDA today. So you should be hearing from us very soon with more information about the contracts and what that will entail for your projects. Overseeing the vouchering process, so I'll talk more about that a little bit in the next slide or two. Monitoring agencies, completing final reports, as Maggie mentioned, and then facilitating regular meetings with subrecipients. So it is our goal to meet with agencies just to ensure that the projects are continuing to meet community needs. And as Maggie mentioned, we will have a tracking system to be able to watch that 20%, 80% spend down that HUD is requiring, and just to make sure that projects are on track. So that is actually what the vouchering system is. So if you can go ahead to the next slide. Oh, thanks. So this is just a little sort of flow of how the vouchering sort of leads into being reimbursed. So you will submit Excel vouchers, which I'll talk about on the next slide, and backups to CARES on a rolling basis. So anytime that you're ready to submit a voucher, you can go ahead and submit a pre-populated voucher right to us, to an email address that we'll provide to you. We'll review those vouchers as they're submitted, and we will approve them for payment through OTDA's mandated grants gateway. So we'll upload the documents that you send us, your voucher documents and your backups, to Grants Gateway. And then OTDA will review those on a quarterly basis on the 20th of December, March, June, and September, and funds will only be drawn down on that quarterly basis. So as the lead contractor, CARES submits vouchers, and then CARES receives payment from OTDA once OTDA has approved those vouchers through Grants Gateway on that quarterly basis. Finally, once that process is complete, CARES will bank transfer those reimbursements directly into agency bank accounts. So that's sort of the flow of the reimbursements, and hopefully that's helpful to visualize the vouchering process. So Maggie, if you could go to the last slide. So a couple next steps for vouchering. So very soon, as I mentioned, Kirsten just received the OTDA contract information today. You'll all be receiving pre-populated Excel voucher templates. And so Charlotte, that kind of answers your question about seeing the budgets broken down. We'll have all that information. And with the voucher process that we've created, it will be super easy to pull any reports at any time about what people have spent so far, what people have vouchered for. So we will have that information for you, at the ready. So all projects will have their own pre-populated Excel voucher with those budget breakdowns. You can expect to get those from me. So there's my email address. So be on the lookout for that. So I didn't want to get too into the weeds with the specifics of the vouchering process. So we will be inviting you all to a webinar to talk more about the details. The Excel voucher will have some sort of auto function so that when you put in what you're vouchering for, it will auto fill in other areas. And so we just wanted to walk through that with you and make sure that, when it's submitted, it's working well in our system on the other end. So you'll be again invited, most likely by me, in the next couple weeks to attend a vouchering training. And we'll also make all of those training materials available to you after the webinar for you to reference at any time that you're submitting a voucher. And then finally, if you have any questions between now and then, please feel free to reach out to myself or Kirsten, but I know that you're going to be hearing from us soon about the next steps for the contract process in general. So, I imagine that the lines of communication will be very open over the next couple weeks anyway. And that's it for me.
All right, does anybody have any questions relating to the vouchering process?
Kirsten, hi, it's Nancy, and Maureen, thank you very much. So I just want to reiterate, because I know you just got the information from OTDA today with the packet. So subrecipients may only voucher 4 times a year?
So they're going to be able to voucher on a rolling basis, or you all will be able to voucher on a rolling basis. And I'm sorry that there's a cat making noise next to me. Essentially, what we can do and what we've talked about with the OTDA is that we can only submit grants quarterly for reimbursement. We can't submit grants on a rolling basis to them, but we will review them on a rolling basis so that once that quarter rolls around, we're ready to go on Grants Gateway and we get money as soon as possible.
Okay, thank you.
Mm-hmm.
Any other questions about vouchering or otherwise?
I'm just wondering, because some of you have seen the emails about the contracts and what the time frame is on that, because I'm concerned we won't be able to do the work from our end, but yet we've got people that want to do this, that are pushing the publicity out now, and I'm concerned that people are going to start calling before we can respond to them. And so I guess if there's any information about the timing of that would be helpful to me.
Sure. So the end of this week, we'll be working on reviewing all the documentation sent to OTD or sent by OTDA to us. There's a lot of it, so I want to make sure I digest it properly and can tell everyone what is going on by the beginning of next week. Kind of do like a helpful FAQ as far as contracts go and for timelining purposes. There are a couple more, I guess regulations is a good word to use with OTDA than we see with entitlement contracts. So in communities like Albany and Schenectady, for example. So I want to make sure, for example, MWBE requirements are met and we can properly address those. Just things like that, little nuances with these that I, again, want to just make sure I know what I'm talking about when I email everyone. So early next week, you'll hear from me with next steps. I should sum up there.
Any questions, Bob or Shar?
No, I think that you've explained it thoroughly. I feel like I feel a little more comfortable with everything that's going on, and it sounds like a great plan. I look forward to it.
Yes, it does sound like a great plan.
Great. Good to hear. Any questions, Louisa or Kyle?
No, I mean, you know, we're just, we've done some pre-planning on moving forward and, you know, we're just waiting to get started. So if I have questions, we definitely know who to reach out to.
Yeah, great. Just to reiterate that, just feel free to reach out. Grants and contracts, planning, whomever, we'll get your questions answered.
Yeah, so we will not be doing I know in Albany, we're submitting the coordinated entry, but that's not going to happen in Columbia County.
I thought yes, it was, but Kelsey, can you confirm or deny?
Do you mean for rapid rehousing or prevention, just to confirm?
Well, for both. I mean, we've been on some trainings for Albany on, you know, the index that we would use, and then that would be submitted to coordinated entry. And we will be doing rapid rehousing, and we will be doing prevention as well. But, you know, Jeanette's not here right now, but she wasn't quite sure if that process was going to happen in coordinated entry in Columbia County.
It is recommended. So Denise is going to be reaching out, Denise, our director of coordinated entry, to start working with the community on that prioritization index for prevention. And yes, rapid rehousing projects should be going through the normal coordinated entry process that we have in place.
Okay, yeah, I would like clarification on that because that's not, we haven't heard anything about that. I don't know if Bob or Charlotte have or Kyle. You know, we didn't hear that it would go through coordinated entry.
Okay, yeah, we can send out some additional information about that for sure.
Perfect, thank you.
And any last questions before we break?
Thank you, Maggie.
Oh, thank you.
Sorry.
Thanks for
Yeah.
joining us, everybody.
Thank
And
you.
again, call us if you need us, and we'll be in touch, and these materials will be posted.
Thank you.
Okay.
Everyone.
Thanks
Take care.
all.
Bye.
Bye-bye.